And let's bring in the Health Minister Mark Butler, who joins us now. Minister, welcome to the program. Thanks for joining us. Let's start on this announcement today, this promise that you're making. Tell us about how this hotline would work.
Well, every Australian will be able to ring a triage nurse 24/7, 365 days a year and get some immediate health advice. That nurse might give you the advice you need to go to a hospital, or you need to go to one of our many Medicare urgent care clinics, or you might be able to be referred to the Telehealth GP consult you guys have been talking about after hours. So it'll be available between 6 p.m. and 8 a.m. every day and fully staffed on the weekends as well. To that point about fragmentation, the difference with some of the private business models that your viewers will be familiar with have cropped up over the last couple of years. First of all, this will be free, completely bulk billed. The second will be very high quality. We'll be very determined to make sure the nurses, the GPs are high quality, and it will be looped back in with your general GP, your usual GP, through the My Health Record system. The GP will have access to your My Health Record, so they'll know your medical history by looking at it, and your usual GP will be informed about what comes out of that telehealth appointment, whether it's an emergency script that you need or some other advice about treatment.
When Labor came to office, soon after that, you did cut a number of, about 70, I think, telehealth items, including some specialist items, longer than 20-minute consultations with GPs. This was post-COVID, but the AMA at the time was critical. It said cutting these services was unacceptable. Are you now, in part, just restoring those services?
Well, they were essentially COVID items, so a lot of the COVID apparatus was dismantled after the end of the emergency period of the pandemic. We also got advice that it was important for general telehealth consults to have a connection with your doctor, to have that history that Anna was talking about in front of the person. So we've been working over the last couple of years getting the best possible advice about how you use this new system of telehealth in the most convenient way, but also a high quality way for patients and for doctors. And we think this latest chapter in our comprehensive program to strengthen Medicare rounds out our Medicare Urgent Care Clinic program, which is really for those things that need face-to-face physical consults. And will give, for example, parents real confidence and comfort that if their child wakes up at 3 a.m. on a Saturday night when obviously you can't get in to see your GP, there's someone on the other end of the phone and potentially a video consult who can give you a sense of what you need to do to care for your child.
But to be clear, people who might be thinking, gee, I'd much rather a free, bulk-billed telehealth GP consultation than having to pay 40 or 50 bucks and wait forever to see the GP locally, they won't necessarily get it, will they? As you mentioned, there's a triage, a nurse will triage whether you're going to have the free consultation or not.
Well, this is really operating pretty similar to the principles of urgent care clinics. This is not intended as a substitute for your relationship with your usual GP. This is intended to cover circumstances where people need to be seen immediately, need some quick advice, particularly, for example, when your kid gets sick. So, it's not intended to replace the relationship people have, a really important relationship people have with their usual GP. So if you've got some ongoing health condition, you should go back to your GP, and the triage nurse will tell you that, as the triage nurses at our Medicare urgent care clinics are doing in those very rare circumstances where people are presenting for something that's not really time sensitive or urgent.
So talking about those regular GP visits, I mean, here in McEwen, people are now paying out of pocket, up to and around $50 a visit. It has increased, that out-of-pocket cost, since the last election. You do need more than your Medicare card. People need their credit card quite a lot of the time as well. Will that out-of-pocket cost come down over the next 3 years if you are re-elected?
We're very convinced that our record bulk billing investment that we announced, the Prime Minister and I, several weeks ago, will change things for people. We tripled the bulk billing incentive for pensioners, concession card holders and kids the year before last, and that worked. That stopped the free fall in bulk billing for those Australians, and bulk billing for those Australians is now, again, comfortably over 90%. We want to get back to that rate for people who don't have a concession card. And that's what this latest investment will do. We've calculated this amount very carefully and are confident that for 3/4 of general practices, they will be better off if they move to a fully bulk billing model. Obviously, their patients will be better off, which is our primary concern, but we calculated this to ensure that it was also in the financial interests of general practices to take up this investment.
But there is some doubt about that, as you'd know, from doctors themselves. A team at ABC News did a survey of about 800 GPs. 90% of them said they won't be moving to full bulk billing under this plan that you've put forward. And a survey by the Royal College of GPs also found about 2/3 don't intend to bulk bill more patients. So what do you know that the GPs don't?
Well, look, I know that these doctor groups have right through the history of Medicare resisted this sort of policy. I mean, the doctors' groups did come to me and say they wanted that additional investment in Medicare, but they wanted no strings attached. Now, no government has invested more in general practice than this one, the bulk billing investments, the 3 biggest increases to the Medicare rebate since Paul Keating was Prime Minister, a whole range of other supports for general practice. But as a health minister, particularly as a Labor health minister, I'm determined to get patient outcomes for that. So we did attach strings to this, and I'm very confident over time, as we're seeing with more and more general practices, particularly the bigger ones that are very good at crunching their numbers, that they will recognise this is in their interests. 2 years ago, a fully bulk billing GP was earning about $280,000 a year after they paid their practice fees. That's according to the sector's own earnings calculator. After this November, they'll go from $280,000 to more than $400,000, earning more than a GP who is doing the average amount of charging gap fees. So it is in their interests. I'm confident they'll see that. It's certainly in the interests of patients, and that is my primary focus.
OK, but back to the original question, will out-of-pocket costs for people in a place like McEwen be lower in 3 years from now than they are today?
Well, more people will be getting bulk billed. That's the purpose of this. More people already are getting bulk billed in Victoria than were before we made our first investment in bulk billing. Bulk billing was in free fall when we came to government. We've stopped that free fall, and in every state and territory it started to increase. But it's not increasing enough for my liking and for the liking of most in the community. So that's what this latest investment is about. For those Australians that don't have a concession card, we want their bulk billing rates to be much higher than they currently are. And you'll see that in McEwen as you will elsewhere in the country.
OK, I want to ask you about urgent care clinics. This has been called the MEDICARE element of this election campaign. Labor's been saying repeatedly that the coalition is going to shut down urgent care clinics. The coalition have, for the record, said they'll keep existing ones. They're not necessarily supporting the new ones you've promised. Has Labor been misleading on this front?
Look, this is not a term I use. It's a term the media and the Liberal Party like. But what I will say is Malcolm Turnbull was asked this very question last week by the ABC, and he said this. He said, the problem Dutton has is he has form in this area. He has a track record that he must wear. People remember that more than 10 years ago, Peter Dutton looked them in the eye and said there'd be no cuts to health, and then a few months later put a wrecking ball through Medicare, trying to abolish bulk billing, trying to make everyone pay to go to a hospital ED, cutting $50 billion from hospitals.
OK, and I understand.
I'm not going to be silenced, David, from
Labor's very focused on
about that risk.
I understand Labor's very focused on what happened 10 years ago, but I'm just asking, in the context of this election, is it misleading to say that the coalition will shut down these urgent care clinics when they've said they will not?
Well, let's talk more recently. For 3 long years since I first announced the urgent care clinic program, it's been bagged uphill and down dale by the Liberal Party. They rejected it when I announced it. They've called it a disaster, a failure. Most tellingly, Angus Taylor has repeatedly said our urgent care investments were wasteful spending that would be on the chopping block at this election. Now, 5 minutes before midnight, just as happened back in 2013, we're supposed to believe that Peter Dutton is now some convert to Medicare, rather than what we know about him, which is he's determined to Americanise our healthcare system. Now, people will make their own judgment. They might believe that he's a changed person, in spite of the fact he's never apologised for what he did 10 years ago. We're still having to pay to clean up his mess. My job is to alert people to the risk. There is a risk in giving Medicare back to a man that doctors voted the worst health minister in the history of the system.
But isn't it the same as the coalition saying Labor will cut negative gearing? They'll remove negative gearing tax breaks because you once argued for that. It's the same sort of claim that's being made looking at the history of the party rather than what they're actually saying at this election.
We've been very open, honest and transparent about what happened after the 2019 election. We've accounted for that. We've changed our policy and explained to the Australian people all through that process what happened and why we've taken a different
Parties
view now.
can change their positions.
Peter Dutton's never done that. He's never said what he tried to do through Americanising Medicare was a mistake and he would never do it again. He's never been upfront with the Australian people. And until he does that, we are entitled to alert Australians to the risk of putting our most important social program back in the hands of a man voted the worst health minister in the history of Medicare.
Can I ask you about where the money's coming from, given we're in deficit for years to come as far as we can see in the budget. You've got a lot of big spending health measures, whether it's the urgent care clinics, the Medicare bulk billing incentives, the $8.5 billion there. Today's announcement on this hotline. Where does the money coming from? Is it all borrowed?
Well, it's all fully accounted for in the budget. This particular announcement, which we think will cost about $204 million, is an election commitment. That will become apparent in the election costings. But all of the other investments we've made to deliver more doctors, more bulk billing, more urgent care, in women's health, men's health, mental health, they're in PFO. And they're there for people to see. They have been for weeks, and they're fully accounted through a budget process that has already delivered
what does that mean?
Budget surpluses. Well, we're
accounted for with borrowed money?
We're accounting for all of our expenditure and all of our revenue in the way that we've approached the budget over the last 3 years, which has returned $207 billion out of debt, means our interest payments are $60 billion lower, lowering aged care expenditure through the coming 10 years, getting NDIS growth under control for the first time in a long period of time. You know, we have taken a very responsible approach to budget, but there is nothing more important than the health of our nation. And these investments in turning around a decade of cuts and neglect, we think are a priority for the country.
There are, of course, many who say there's nothing more important than defending the nation. Let me ask you about that, just moving beyond your portfolio briefly. Big increase in defence promised by Peter Dutton during the week. Does Labor plan to increase defence spending beyond what's already in the budget?
Well, first of all, let me say in the budget you see the biggest expansion of defence spending in a peacetime period since World War II. $10 billion extra in the forward estimates, $50 billion over the next 10 years. Every dollar accounted for in the budget and every dollar paying for a capability identified in the Independent Defence Strategic Review. It's very different to what you got this week from Peter Dutton, a figure plucked out of air with no indication about where the money's coming from, let alone what it will buy. Now, the Prime Minister has said over the weekend... I'm just asking about your plans. Will you spend more than what you've put in the budget? Well, as I was about to say, the Prime Minister has said over the weekend, if, you know, obviously circumstances change, we recognise we're in a very volatile, uncertain global environment, and defence indicates that more assets are needed, of course we would look at that through a future budget process. But I come back to how we've done this over the last 3 years. When defence comes to us, the Independent Strategic Review identifies capabilities and assets that need to be bought, then we have put that in the budget. The biggest expansion in peacetime since World War II. You see defence spending growing as a share of the economy or GDP over the forwards and over the 10 years. If more needs to be done, of course the Prime Minister has indicated we're open to doing that.
And you'd find room in the budget by, what, borrowing more or cutting something else?
Well, let's see how those future years roll out. But as I said, at the moment, we've got very substantial growth, the biggest in peacetime years since the end of World War II. But it's to buy identified capability, and that's the important thing. What you saw in the last government, when we came to government, was $42 billion of press releases and announcements that had not a single dollar attached to them in the budget. That's not the approach we've been taking.
Final question, Mark Butler. If on Saturday night we find out that voters have produced a hung parliament at this election, what approach will Labor take?
Well, we'll take the same approach we've taken with the majority, which is putting our vision and our plan for the nation to the parliament. You know, we are pushing very hard for a majority government. We think a majority Labor government will deliver the continuity, the stability, the certainty the country needs in a very volatile global environment, and that's our focus.
I understand that, but I'm just asking, if we get a hung parliament, what will Labor do? Will Labor actually, who will you talk to first?
Well, the Prime Minister, that's a matter for the Prime Minister. He's made it very clear that there are no deals. We're not a party of coalition, unlike the Liberal Party. We'll be putting our plan to the Australian Parliament, whether we have a majority of seats or if we were delivered slightly less than a majority. I mean, that's the Labor way. We have a plan. We're confident it's the right one for the country.
All right, Health Minister Mark Butler, I wish you well for what's left of this campaign. Thanks for joining us this morning.
Thank you, David.